So hi everybody, good morning. Nice to, well, sort of see your names anyway. So today we have Diane, who is a medical, she's a trainer now, but was doing medical device sales representing to hospitals, doctors, surgeons, that kind of thing. So I'm gonna let her introduce herself, and please tell me what you do, and also your path to where you are now and your background.
Okay, no problem. So thank you all, first of all, for inviting me to speak to you and tell you a little bit about myself. My name is Diane Houston, and currently I work for a medical device company and am a sales trainer for them. So basically what my role is right now is any new hires that get hired into our company. I train them on our products, as well as training our existing sales force on new products. And then I also help launch new products to the market. So I work with our marketing team and R&D, clinical, to help bring new products to our customers. So to explain a little bit about what medical device sales or having a career in medical devices is, I don't know if you've known anybody who's had to have surgery or anything in a hospital or a surgery center. And basically, there are companies that work with the hospitals and the doctors that help provide the products for them that they use in the hospitals. And so that's what I do as working with the companies who help provide these products to hospitals and physicians, so it helps make their job hopefully a little bit easier. So how did I get here? So I started, obviously graduated from high school and went on to college, and specifically I majored in marketing and international business, but really you can almost major in anything and still potentially have a career in medical device sales. But I would say the one thing that was a real game changer for me in terms of helping me get started in my career was that I interned, and I did an internship starting my freshman year in college. And I just encourage all of you all, if you decide to go to college, that you really take advantage of all the opportunities that are available to you, such as internships, because had I not have interned, then I would have never known about a career in medical devices. So I know, so but mommy's talking. And when I'm done. Sorry about that. I have a 4-year-old at home who is not being settled. So I apologize for that breaking conversation. Okay. I was saying I interned, and so, when I was looking for the internship, one of the things I will say to you all is, even though you think you might know exactly what you want and what you want to do, be open to new things. So I just knew that I was going to be like this big advertising executive, and that's the kind of internship that I wanted. And as I was walking around the different tables, looking at the different companies, this a medical device company caught my eye, and I was like, oh, this sounds kind of interesting. I'm gonna go ahead and apply. And I applied, found out more about the career and, how we partner with physicians and hospitals and, really try to make a difference in healthcare. And that was very intriguing to me. And so luckily I participated in a program called Inroads, which is what provided my internship. And I interned with the company Johnson & Johnson for 3 years every summer after in college. And then once I graduated, they offered me a full-time position as a college graduate. And so I worked for Johnson & Johnson for 6 years, almost 6 years, and then was looking for new opportunities and started at the company that I'm at today, Medtronic, and was a sales rep for them, just like I was for Johnson & Johnson. And as a salesperson, I would go into the hospitals or doctors' offices, tell doctors about my products, work with them in the hospitals, making sure they knew how to use my product, and that they were successful with it and enjoyed it. And, again, really got a chance to partner with my physician partners in the hospitals and helping make a difference in patients' lives. So I was in sales for almost 12 years, and then decided that I wanted to do something a little bit differently. And still with my same company, Medtronic, I decided to look for a little different career path. And that's how I got into the training aspect. And so now, like I mentioned before, I train all of our new hires that come into our company, train existing sales reps, and help partner to bring new products to market. So I know I just said a mouthful. And I don't know if the guy has any questions. You know, I'm definitely an open book, and, you know, you can ask questions about, again, my journey, what it's like being a sales rep, any kind of question that you might have.
So I wanted to talk to, I know that you had talked about inroads. I just wanted to mention that Kaiser Permanente is an inroads site that for college students. And I know internships are one of those things that you really need to do in college. And I know that you had partnered with Inroads, and they have many different companies, but that's where you get the college experience, because how do you get experience without experience? It's through college internships, right?
Yes.
So was that a paid full-time job in the summer, or how did you apply for Inroads, and what was that process like?
So when I was in undergrad, I went to the University of Cincinnati, which you all are all the way in California, so you probably are like, Cincinnati, but in Cincinnati, Ohio. And I had a scholarship. And so at one of our scholarship meetings, a representative from Inroads came and spoke to us and told us about this career fair they were having and encouraging us to come. And I will say, when opportunity knocks, you all should definitely open the door, because not everybody came to that career fair that Inroads had offered. And I just thank God that at a young age, I was like, okay, you know what, maybe I should go ahead and go to this. And this really helped shape my career. I would not be where I can truthfully say I would not be where I'm at had it not been for Inroads. So when you hear about opportunities, definitely take advantage of them. You'll be surprised, unfortunately, at how many people might not take advantage of opportunities. So I just really want to encourage you to, when you get opportunities, whether it's internships, mentorships, we're offering to mentor you, just take advantage of those opportunities, because they can really be helpful in terms of your growth and development. But I think to answer your original question is that yes, so that's how I found out about Inroads, went to the career fair, got the job, and it was a paid internship where I made pretty good money as a college student every summer, working in a corporate environment. And it was some of the best experiences that I've ever had. I met wonderful people who I still am in contact with today, mentors who helped shape me into the businesswoman that I am. So I'm very, very fortunate and grateful for Inroads. And if you have an opportunity to get an internship through Inroads, I highly, highly recommend it.
And did that continue? Did you do 1 year, or was it continuously throughout college?
All through all 3 summers. So the summer of my freshman year, summer of my sophomore year, summer of my junior year, and then at the end of my summer internship in my junior year, the goal was that you would get a job offer. So then once you graduated after your senior year, you would have a job. And thankfully, they offered me a job at the end of my junior year. So my entire senior year, I could just focus on my schoolwork, having fun with my friends, enjoying my last year in college, because I already knew I had my job lined up, ready to go once I graduated in June.
Great. So that's the way to build your resume. I just actually put the website, I believe that's the website in the chat.
Okay.
If anybody has a question for Diane, please put it in the chat, or feel free to speak up. So when you started out, hello.
I'm so sorry.
Everybody's in the same boat. So
I hope they understand.
So when you first started out, when you said your first job was at medical device sales right out the gate, then after Inroads, after you graduated?
Yes, so the same company that I interned with, it was a Johnson & Johnson company, which I'm quite sure you guys are all maybe familiar with Johnson & Johnson because they do a lot of consumer products, baby products, things like that, but they also have a pharmaceutical and a medical device side. And so at the company that I interned with offered me that job, and I got into medical devices right away. Now, which I'm so very fortunate for, because it's not always sometimes the easiest to get into medical devices. So I was very lucky to get the experience that I had, the relationships that I had within with the Johnson & Johnson, the company with Johnson & Johnson, and then was able to start in medical devices right out of college.
And then also, I know you talked about it's really helpful to know about anatomy and a little bit of biology and that kind of thing. And so because you are talking about these when surgeons implant them or use them, you have to know how the body works and that kind of thing. Can you talk a little bit about that and how your knowledge has helped you?
Yeah, so I mentioned that I was a marketing major in college. So I was as far from science almost as you can be. But the good thing is when you go to these companies, and like I said, you can have a various background. I know people who have a background in biology or chemistry or even psychology, and they work for medical device companies. The good thing is even if you don't have a background in anatomy, anatomy, that you'll learn that. So that's the job as trainers. We teach you what you need to know about not just the product, but you have to be knowledgeable about the body, anatomy, disease state, but you learn all of that. I know you all have a specific, who I'm speaking to, you all have a specific focus on like sports medicine. So you're already learning about different anatomy. And so if this is something that you're interested in, you kind of already will have a leg up over some people because you've had exposure to those science anatomy topics that you have to learn as you're going through training with these companies.
Right. And so was it really complicated? Is a lot of complicated things to learn since you didn't have a background in that? Or is it just each device you kind of learn different things about how they work?
Usually each device, so depending upon what type of products you sell will determine what your knowledge is of that you'll have to learn for anatomy. So for example, the company with Medtronic that I work for, we specifically, the business unit that I work in, we specifically make a product for patients who have fecal incontinence or urinary incontinence. Okay, so basically they pee and poop on themselves for to use not so great terms, but just so you understand what I do. So I had to learn everything. We learned about the excretory system, about how the bladder works, how the communication from the bladder and the brain. So because my specific product works on that part of the body, I don't have to learn about the bones or the muscles, in my body because that's just not pertinent to what I do. So whatever you do and whatever product that you sell, you'll learn all about the disease states, the anatomy, for that specific part of the body. So you don't have to be an expert in everything. They'll definitely teach you what you need to know.
And then talk about, you said, well, your background in marketing, because you are marketing, kind of selling these things to doctors and surgeons and things like that. And so how does that particular thing work? Do they already know that they need something? Like, do you feel like it's a pressure thing, or do they already know they want your product?
So sometimes they don't know that they want or need my product. So that is part of your role as being a salesperson, is to find customers, right? And there are a lot of different ways that you can target who might be a good candidate for you to go talk about your product. But you're always going to grow and get new people utilizing your therapy. So sometimes you get calls from doctors say, hey, I heard about this, I want to learn more about it. And sometimes it's, hey, I want to set up a meeting to meet with you, Dr. Jones, because, I think I have something that you might be interested in.
And then you did talk about, meetings. So kind of walk us through like a typical day. What does a typical day look like for you?
So I'll give you 2 typical days. So I'll tell you a typical day for me right now as a sales trainer, which is a little bit different than a typical day when I was a salesperson in the field. So for me right now, as a sales trainer, my company's headquarters are actually located in Minneapolis, Minnesota, and I live in Indianapolis. So you're probably like, oh, wow, you know, how does that work? So when I'm not having to travel for work, I work from home and again, work with my colleagues back at the home office, again, whether it's developing new content, helping with product launches. And then when I have new hire training classes, then I fly to Minneapolis, and for 2 weeks I'm in Minneapolis and go into our headquarters, and we teach and train all the new employees that we have. I've been, again, very blessed to have the opportunity to have the job that I do, because not only do I fly to Minneapolis and do trainings, I've had to go overseas, to Europe, to Paris, to Switzerland, which is in Europe, but to train and educate people on our products. So it's not always, I guess, a typical day, because some days I'm working from home. Other days I feel extra fancy when I get to fly to Paris and train some of our colleagues over in Europe. As a sales rep, I would say, you know, no day was ever the same, even though you always had the same goal of, you know, getting more of your clinicians utilizing your product or being in surgery with my doctors, working with my product. But, you know, it was always exciting getting to go into the hospitals, seeing how my patients, my product helped the patients, working with my doctors. So, you know, I could be at one hospital in the morning and a totally different hospital in the afternoon, and in between maybe stopping at some of my other doctor's offices to maybe drop off literature, have a lunch to talk with them more about my product. So as a sales rep, you're kind of always on the go. And sometimes your day can be a little bit unpredictable, but as long as you keep your, you know, your goals in terms of what you're trying to accomplish that day at the forefront, you'll be able to be successful.
So would you say, like, what are your hours like? Are they typical Monday through Friday then from 9 to 5, or does it just depend on your meetings and what you're doing and where you are?
So it depends. So most days, now that I'm in sales training, I would say maybe my days are a little more predictable, that, you know, 8 to 5, sometimes 8 to 6. But when I'm doing new hire training, sometimes, you know, my trainings go late a little later, or I meet with students, you know, in the evenings to help them. So sometimes, you know, I'm working till 9 o'clock at night. And then some days, you know, especially if I work from home and I've gotten all my work done, maybe I can take the afternoon off on a Friday and I'm done by 12. As a sales rep, your schedule, especially ones who work in the hospital and the ORs, you're kind of at the mercy of the surgery schedule. And so sometimes surgeries run late. And, you know, if surgeries run late, then I'm at the hospital later than I anticipated. So it just all depends. And so when you start, so when you're in the field as a salesperson, it can vary.
So I know that when we had talked, you talked about observing surgeries and that thing as a sales rep.
Mm-hmm.
And is that done? Is that scary? Because I know that some people want to go into medicine and they don't like, you know, the blood and guts of it. But how is that for you, handling observing the surgeries, and how was that?
I love being in surgery. So, I mean, I know sometimes we watch these TV shows like Grey's Anatomy, and, you know, they've got sometimes all kind of crazy stuff, blood shooting from the ceiling and all this stuff. It's not really like that in the real world. It's very much more contained, and things going well. So, yeah, for me, it wasn't a problem, you know, as long as you don't, you know, seeing incisions and, you know, maybe different parts of the body doesn't make you queasy, you know, it's a great job, and it's a great opportunity, again, to still impact healthcare, but from a different perspective, you know, versus being just a physician or a nurse or something like that.
Now, are you in the actual room of the surgery room, or are you kind of above in the observation area?
So for typically with me, and again, it's all about, you know, developing your rapport with your physicians, but you are actually in the room with the physician. Now, I'm not scrubbing in and I'm not helping him, you know, with the surgery, but I am literally in the OR room, mask on, scrubs on, and they're in the room to help answer questions, you know, for the doctor while he's using my product.
So are you in there when they first initially insert the device, or do you have to, is that where you're there to provide support when they first start using it?
So it depends on the type of product that you have. So when I worked for the Johnson & Johnson company that I was telling you guys about, I wouldn't come in until pretty much right, almost when they were getting ready to use my product. So the patient was draped, prepped, ready to go. I might be walking in with the doctor as he's, you know, scrubbing in, and then we start the procedure and I'm there to help. With Medtronic, our product is a little bit different. And so sometimes I'm in there as they're positioning the patient on the table just to make sure that they get them positioned the right way for the doctor. And so it really just depends, but you'll be in there with your physician.
And you're in there the whole time for the whole
Again,
surgery?
Yep, it depends. So for the product that I sell right now, or with Medtronic, yes, most reps are typically in there from beginning to the end because that's all they're doing. But when I was with Johnson & Johnson, you know, maybe they're only using my product at a certain part of certain part of the procedure. I only need to be there for that, you know, small part, and then the rest of the time, you know, then I can leave after he's done utilizing or she's done utilizing my product. So it just depends.
Okay. And so would you say that's kind of a big part of what you do as a sales rep, or not so much?
Supporting your product.
Uh-huh.
And yeah, a big part. So that's a big part of what you
Okay.
do, in addition to trying to, you know, get your doctor to maybe use more of your product, or looking for new prospects, new doctors to use your product.
Okay. And then you mentioned that, you know, you engage with people, so you really have to be good with people for this job because it's a sales.
Yes. Yes.
And that's a huge, I'm assuming that's how it starts, right? You have to initiate conversation and kind of
it'd be a little bit,
maybe
a little difficult to be kind of shy and have a career in sales, because you definitely have to like to talk to people, be around people. You know, you'll get no's, and you kind of have to be okay with that, and, you know, kind of dust yourself off, keep going to the next one. So yeah, you definitely have to like people I think to be, you know, successful in a career in sales.
So with sales, is it something that you cold call people, or do they have a list? So your company gives you, like, these doctors might be interested in your product, therefore you kind of have a lead.
It depends. So usually when you get hired, you know, you get hired for a certain area, and so you'll have certain doctors who are already in your territory that you'll have to work with. But then it's also up to me, again, maybe to find either new physicians to help grow my business, or, you know, continue to grow the business with existing doctors that you have. So it's a little bit of both.
So what are some perks that you have on your job that you really enjoy?
So I really enjoy helping people. And so really getting to see, especially with the product that we sell with Medtronic, you know, it's great because we have the opportunity to see, you know, patients who don't have a great quality of life, and then they get exposed to your product, and, you know, they have a lot better quality of life. So that was one of the things that I enjoyed. I had some great physicians that I worked with, so I really enjoyed partnering with my physician customers because they were fantastic. So those were, you know, some of the perks and of the job. From being able to support yourself. I would say being in specifically medical device sales can be a lucrative career. So, you know, it'll definitely allow you to support yourself, you know, your family once you have families, and, you know, travel and just, you know, do what you want to do. And I would say the other last part is just the opportunities. Again, I mentioned that, I've been able to travel to other countries, for work and, just have a lot of different experiences. So I would say those were some of the perks of this position.
Great.
Potential.
Yeah, and then we talked about earning potential. So when you first start out as a sales rep, what were the earnings there, and then what potential earnings as you go on? What are those?
Right. So like I said, I mean, I've been in medical devices for almost 20 years now. So when I first started, almost 20 years ago, coming out as a new sales rep, you typically make a base and commission. And so at the time, I think my base was probably somewhere around that 40,000-ish dollar mark, and then you make additional money on commission. So if you hit your number or sell the amount of quota, items that they want you to sell, then you get, this much money. And then if you sell over that, you get even more money on top of that. So that's why I say your earning potential is almost unlimited, because a lot of times you get a base salary and commission, and a lot of times your commission can be uncapped. So however much more you sell over what they want you to, you're making that much in over planned dollars. So again, you're able to make upwards of, depending upon what your base is, maybe $200,000 or more a year for a successful rep.
So potentially that's probably on more than a regular physician would make, I think, with the...
Yeah, it depends.
Well, surgeons make, I think, the most.
Yeah, surgeons make a lot. Surgeons make pretty good money. So
yeah.
It depends. But like I said, it's not so much I look at it as, I can make more than a doctor. It's, I do something that I enjoy. Mm-hmm. And I'm able to support myself and my family, off of it. And so I just want to make sure that you guys know there are other career opportunities out there, because I never knew anything about medical devices when I was in high school, and didn't find out about it until I happened to go to this career fair, and this company was there that sounded interesting to me, and I, talked to them and found out more about it. But there are other career options that you can do that are in and around medicine that you can still have a very lucrative career in.
Mm-hmm. So is there anything that you would recommend, like what type of personality types? I think you had mentioned you can't be shy. Any other advice for people as far as who should be great for this particular position or career?
Well, I say, honestly, anybody could have a career in sales if you want to. I think one, like I said, you gotta like people, because a lot of times you spend time talking to people, wanting them to use your product. You kind of also have to be a person who you don't, if somebody tells you no, you don't take it personally, because, you're going to have doctors or nurses or whatever tell you no, but you got to be able to, like I said, dust yourself off, get up and then go on to the next, person, and can't have this, woe is me, type of thought, because somebody's always going to tell you no, and that's okay. You just move on to the next person, figure out maybe why that other person said no, so that way you perfect your message to be able to go to the next doctor or nurse and then get that yes that you want to get.
Right. Do you have any crazy stories?
Crazy.
Interesting.
So let me say this. So not any crazy stories maybe that I can quite share with you all now, but there are especially with the product that I sell now, and I work with patients, you get to meet a lot of interesting people. Let me just say it that way. You have sometimes a lot of interesting conversations, and so yes, but none that I can think of right now that I feel like are appropriate to share. But yeah. So I'm sorry, maybe I didn't. wasn't quite right, but I have to remember who my audience is.
Well, I mean, it's, yeah, I'm sure they can handle it, but, and then, anything you don't like about what you do, any kind of negatives?
I will say sometimes the downside about being in sales, like I said, you have the opportunity to meet a lot of great people. You do a lot of interesting things. You get the chance to help people, but at the same time, you're also in sales. And so your manager, your company, kind of expects you to hit your number, right? Because you have a quota as a salesperson of how many, items you need to sell. And so sometimes that can be a little stressful at times. So that I would say probably that's can be the toughest part about sales, is managing the stress of, trying to make sure that you're always performing to the level that you should perform at from a numbers standpoint.
Mm-hmm. Well, you've been successful at it, so I guess it's a good fit for you.
I say if I can do it, definitely anybody can do it. And that's why I just wanted to thank you all, like I said, again, for the opportunity to talk to you, just to talk about myself and tell you about my experience, and just let you know that there are different careers, and that maybe if a career in medical device is for you, that's out there. And if anybody ever has any questions or want to know more, or seriously maybe considering a career in sales, and specifically medical device sales, that somebody, and if you want to reach out to me, that's totally fine.
Okay, I will definitely share your email with Mr. White. He's the instructor. He's in here also.
Okay.
Do you want to open it up for questions? If anybody has any questions for Diane, you can put it in the chat box or unmute yourself. I think we went over some stuff, but you never know what people want to know about.
Right.
I'll
ask a question.
Yes, go ahead.
So in the industry, do you find that the new products that come out are more like newer products, or just like better versions of old products? Like, considering how far we've advanced in medicine, like now.
Mm-hmm. So sometimes you get a little bit of both. So sometimes you get, and again, it depends upon, I think, the industry that you're in, but sometimes you get products that are improvements over existing products. Other times you might have different companies, and sometimes you hear those referred to like a startup companies, because they are coming out with something totally new that is used in the market. So I'll give an example. Like there's this company called Inspire Medical, and they came out with a totally new product for patients who suffer from sleep apnea, which is basically when people sleep at night, sometimes they unfortunately stop breathing in the middle of the night. And so right now, a lot of times people will have what you call like a CPAP machine that they hook themselves up to at night to help make sure they don't stop breathing in the middle of the night. And this Inspire company came out with a totally new product that helps patients with sleep apnea, but that's totally different than a CPAP machine. So I say there's both. Or like, for example, my company, coming out with a different type of neurostimulator, still to help the same problems with the patients who have fecal incontinence or urinary incontinence, but a different type of neurostimulator still to help with the same problem. So you get both.
All right, thank you.
You're welcome. Good question.
Do you have any other examples of other medical devices that might be used to implant in patients?
There's so many different medical devices that are out there. Gosh, I mean, you have companies that are, okay, baby girl, you have to sit down. There are companies that make orthopedic products. There are companies who make products for physicians, and laparoscopic or open procedures, products, cardiac, products, thoracic products. There's robots now that help assist doctors, with surgery, specifically laparoscopic surgery. So there are tons and tons of different types of medical device companies that are out there.
The ones that for medical devices, I always think like, you know, a hip replacement, they got a fake knee or a hip or something, you know, like that.
That's one type of orthopedics, right?
Yeah.
Those things. But like I said, my company, we make products for, I specifically, you know, my business unit makes products for people with incontinence, fecal and urinary incontinence. We have products for patients with Parkinson's disease. So it's just all everywhere. I mean, really, literally, there are different products or, you know, maybe implants for problems with people who have issues with the brain, all the way down to the soles of your feet, you know, looking at orthopedic companies and everything in between.
Okay, so it sounds like a lot. There's a lot of stuff.
Yeah, there's a lot of different opportunity and different companies that are out there.
Okay. Any other questions? Crickets. All right.
And if anybody, like I said, is too shy to ask a question live, I know you share my email, and please don't hesitate to reach out if you do have a question, because I'll be more than happy to willing if you're, you know, a little unsure about asking a question in front of the whole group.
Yes, thank you for that. And I'll get that out to Mr. White. Mr. White, do you have any questions? He's in there. Okay. Well, thank you so much for your time. Please, if everybody, you know, this is just one of the aspects in medicine. There's so many different types of careers. So I'm glad we were able to highlight your career, because people think medicine is doctor and nurse and stuff. So
right.
Physical therapist and that kind of thing. So this is just one other thing if you're good with people, and the earning potential is great. So please, Inroads, I put the website in the chat. I also will send that over to Mr. White. And thank you so much. All right, Diane, thank you so much. Have a great day.
Thank you all so much. Enjoy the rest of your day.
All right, have a great day, everybody.